Hi, and welcome to the Leaside Orthodontic Centre. Congratulations, your braces are off. However, the treatment is not quite over yet. The treatment is over for being in the active phase. Now we're going into the retentive phase. So you will be wearing a combination of fixed and removable retainers. Now, the fixed retainer is a wire that is placed on the lingual, the inside of your teeth. You will either have it on the bottom or the bottom and the top, depending on the treatment plan that Dr. Arat will discuss with you. We also have two options for your removable retainer. And for the removable retainer, we have the traditional and we have the aesthetic retainer. Now, it's important to remember with the removable retainer, for the traditional one that has the wire, what you want to do is you want to remove it by using the metal prongs that go around your molars. You want to remove it the same time on each side to avoid it from breaking. And then when you place it in, you place it and you click it up with your fingers. Try not to bite into it, because you want to try and keep these retainers in great shape for as long as possible. Now, with the retainer, which is the aesthetic retainer, unlike an Invisalign tray, this retainer is a lot more solid, it's thicker, and it'll last a lot longer if you take your fingers and you remove it on both sides at the same time. By doing that, it will avoid fracturing in the middle. If you tend to take it off and then try to peel it, what will happen is that over time, you will get a fracture at the midline. So again, taking it out both sides is ideal. Again, inserting it by using your fingers and not biting into it. If you are finished using your retainer and you take them out for eating and drinking, especially for meals, please put your retainers into the case. If you wrap it up into the napkin, a lot of times that napkin will end up into the garbage, and then you're going to be spending your time rifling through the garbage. So please, if it's not in your mouth, it's in the case. For those of you who have pets at home, specifically dogs, they love retainers. Please keep them out of reach of your animal. They will love to chew on that retainer. So just keep it out of reach. In terms of oral hygiene for those removable retainers, what you want to do is you want to take a soft bristle toothbrush and you want to clean the retainer. You can either use a liquid hand soap to do so, or just some warm water to remove any plaque and debris that accumulates in and around your retainer. Dr. Arat and the oral hygiene team will provide you with Retainer Bright tablets. What you want to do is you want to dissolve the tablets in some water to refresh your retainers once or twice a week. You can find these in any pharmacy and use those to freshen up your retainers. In terms of your fixed retainer, this is the one that has the wire behind your teeth, either on the top and bottom or just on the bottom. What you want to do is you want to make sure that you brush your teeth normally and you use the electric toothbrush to clean in and around that fixed retainer. It's absolutely essential that you floss underneath that wire. Food and plaque and bacteria will get caught underneath that wire, and if it stays there for a prolonged period of time, your gums and your papilla, which is the tissue that goes in between your teeth, will get very red and swollen and inflamed. So what you want to do is this super floss, which we provide you with, you want to go underneath the wire and fish it out onto the opposite side. You can use your tongue to try and lift up the super floss on the opposite side. It's important to make C shapes with that super floss, going down into the papilla, almost like you're shining your shoe, removing that plaque and bacteria in between your gums and your teeth. You do so on each side. After you finish that surface, you take the floss out, you follow through on the other side. So you go in between each one of your teeth that the fixed wire comes in contact with. And using some mouthwash is also great to try and freshen your breath, remove some of that plaque and bacteria, and allow for a nice fresh mouth. Great, so good luck wearing your retainers. Please do so. It's extremely important to wear it full time for 6 months, and we look forward to seeing you at the practice.